Every day, thousands of people are rushed to the emergency department with chest pain. But here's the surprising part. 9 in every 10 patients are not having a heart attack. Yet they're all still being funneled to the emergency department because that's where the blood tests are performed that inform a diagnosis, adding more pressure to overwhelmed hospitals. But what if you could safely rule out a heart attack before the patient ever gets to hospital? Well, a major clinical trial from the Netherlands called the Artica study tested exactly that. Instead of automatically sending low-risk patients to the emergency department, paramedics used a simple, portable troponin test right there in the ambulance, or even the patient's living room. Troponin is the key biomarker doctors use to detect heart damage. Normally you do this sort of test in the hospital, but in this study, paramedics used a point-of-care device that gives results in just 12 minutes. If the troponin level was low and other clinical checks indicated the patient was low risk, paramedics would refer them to their local GP instead of taking them to the emergency department. The trial included 863 patients with low risk chest pain. Half stayed at home with the ambulance test, the other half went straight to hospital the usual way. And the results were honestly a bit mind-blowing. The pre-hospital test strategy saved €611 per patient over 30 days. That's huge! Scaled nationally, the authors estimate €48 million of savings every year in the Netherlands alone. Now here's the really important part. Rates of major cardiac events in the GP group were statistically the same as the emergency department group. Among patients that were ruled out for heart attacks, their risk of having major cardiac event in the next month was well below 1% in both groups. In other words, the decision not to send the patient to the emergency department was just as safe as sending them. This study shows that not everyone with chest pain needs to go to hospital. With the right tools in the ambulance, paramedics can safely rule out heart attacks on the spot, reducing overcrowding, saving money, and giving the patients a faster answer. It's a glimpse into the future where healthcare starts and sometimes ends right in the patient's home.